Well, millions of Americans have substance use disorder. Addiction is a chronic disease that changes the brain and alters decision making. September is National Recovery Month, and the theme is Recovery is Possible. Today on Community Connections, SAMHSA, the Substance Abuse and Mental Health Service Administration, will provide a national overview of recovery, and we'll take a look at substance abuse disorder and recovery programs for our veterans, as well as the challenges and needs of women suffering from it. Our Be More Lifestyle host, Alex Parker, speaks with Dr. Kleinsmith, Deputy Director of SAMHSA, about national efforts to improve substance abuse and mental health treatment services to those who need them most.
Recovery from substance abuse and mental health conditions is possible and is real, restoring every aspect of life. September is National Recovery Month and promotes the professionals and evidence-based treatment providers and recovery practices. It's an opportunity to celebrate our country's strong recovery communities dedicated to making America healthy again. Joining us now is the Principal Deputy Assistant Secretary of SAMHSA, Dr. Arthur Kleinsmith, PhD, MBA. Dr. Kleinsmith, thank you for being with us.
Well, really appreciate you having me on.
What is National Recovery Month? What should we know?
National Recovery Month is an opportunity to celebrate everybody who actually worked through mental illnesses and addiction to come on the other side. The reason we celebrate it is because in my opinion, it's a huge character building exercise to work through some of your greatest challenges, to surmount those challenges, emerge on the other side, and to use your story and everything that you went through to actually help the next guy achieve recovery as well. So I have always been somebody who actually congratulates and celebrates people who actually overcame their hardest hardships in life.
Absolutely worth celebrating. For folks who might think it's impossible to recover, what should they know? What should all of us know about the possibility of recovery?
The possibility is real. And I've always maintained and I worked in the treatment field for a long time. I'm somebody in recovery myself. And then for my own recovery, I became a treatment professional. But I tell everyone that I work with that nobody is too sick to recover. And I absolutely sort of believe that, and I've seen it a lot of times in my life. And I refer to recovery as the miracle of recovery. It's not too many times that somebody can actually take everything that they went through, every hardship, everything that invokes shame, everything that they're depressed about, and take those experiences and turn that into assets. And with recovery, you take all those experiences that you thought were overwhelming and too burdensome, and you change that and convert that into an asset where those experiences can benefit other people.
How do we help folks, sort of collectively, all of us, how do we help folks achieve and sustain recovery?
Well, I go with, first of all, we have to make sure everybody understands that it's achievable for everybody to actually earn recovery, be in recovery. And I also like the idea of modeling recovery, where somebody can actually help the next guy. I see everybody as a potential resource in this battle. Anybody that went through it can actually help the next guy. So the more we could get on message and let people know that recovery is real, that recovery is something to be celebrated, I think the more we could actually find people to go on board. I've also, before I became a licensed therapist, I was a peer worker. So I'm also very impassioned about peer-based recovery, where people actually went through this and can help the next guy through his journey as well.
Oh, we see the logo behind you, SAMHSA, the Substance Abuse and Mental Health Services Administration. This is focused on supporting recovery, health, home, community, and purpose. What should we know about your organization, how you all help folks?
Well, SAMHSA has been, that's what our acronym, SAMHSA. We've been some of the leading voices in recovery and serious mental illness for since our founding. We do a lot of, we fund it. We're an organization that funds recovery. We fund treatment. We also do research, and we provide the guiding arm to a lot of individuals in the field. So they look to us as being a leader in this area.
What resources?
We have excellent treatment staff. We have an excellent team here as well, and we're working with, and we have a HHS secretary Secretary Robert Kennedy is also in recovery himself. So we're actually spearheading this movement.
Thank you for that. What resources exist for folks who are seeking help?
Well, on our website, we have findtreatment.gov, which is an excellent resource. You could go on that resource. You could be a family member. You could be a loved one. You could be somebody looking for treatment yourself. And within that resource, you could find the type of treatment that would fit your needs the most.
Any parting words from you, whether it be for folks out there looking for help themselves? We all know somebody. Sometimes it's us that would enjoy and benefit from help. What would you like folks out there to know about the work you all do?
Well, the work we do is we're actually trying to restore lives. We want to aid and alleviate the suffering that we see. Right now, we are working on executive order to actually help homeless people find treatment into a self-sustaining, self-sufficient life of meaning and purpose. So that's really sort of what we're focused on. How we work together today on my treatment team is, on my staff here is, we look at it almost like a multidisciplinary team. So we have America, we have the nation's mental health and addiction issues, and we decide on how best to target and treat the high areas of need in this country.
Dr. Kleinschmidt, thank you so much for your time, for your insight. We appreciate it. All the best to you.
Same here. Really appreciate that.
September is National Recovery Month, and the message is recovery is possible. Coming up next, we'll examine substance abuse disorder on our veteran community.
The bravest person I know is definitely my dad, 100%.
My friend Sean.
My daughter Cynthia, and she was in the United States Army.
One of the bravest things he ever did wasn't when he first enlisted, it was when he found his first support group.
Our journey has not been easy.
One of the bravest things he did was when he asked to move in with me and my mom.
I felt like I was lost, and you gave me a place to stay.
When he decided he was going to go back to school after 23 years.
It was the better part of my life that I spent in the Marine Corps. Transitioning out, it's a difficult thing.
She went on foreign soil. She went to war. But the bravest thing she did is when she asked for help.
So I really appreciate it.
Most hiring algorithms would scream me out.
Some bosses couldn't see me as a leader.
I've run this place for 20 years, but I still need to prove that I'm more than what you see on paper.
I've been running code as long as I've been able to reach a keyboard.
This is what I do. It's second nature for me, coordinating 100 details at once.
It's the way my mind works. I have a very mechanical brain.
I sold them on my skills.
You gotta be so good they can't ignore you.
My magic is
Analytics and empathy. That's how I'm getting clients. You have to have the confidence in yourself to show up and defy the odds.
I am more than who I am on paper.
I never got a college degree. And today, I'm the CEO of my own company. People want to tell me I'm one in a million, when actually I'm one of millions. Stars are all around us. It's time for them to shine.
Substance abuse disorder knows no boundaries. It impacts the wealthy, the poor, the young, old, laborers, and professionals. Veterans are at increased risk for using alcohol or drugs in problematic ways due to a variety of experiences linked directly to military service. Military culture, exposure to stressors, and trauma related to service or combat, and chronic pain or physical health issues can also influence substance use. Dr. Aaron Jacoby, director of the Mental Health Clinical Center at the VA Maryland Healthcare System, joins us to shed some light on substance abuse disorder in our veteran community. Dr. Jacoby, thank you for being here.
It's my pleasure.
Thank you for what you do for so many of the most important folks among us.
It's an honor and a privilege to serve our nation's veterans.
Can you please share an overview, in your opinion, of substance abuse disorder in the veteran community?
Well, as you said, veterans are at increased risk for substance use disorder, and it's because of the experiences they have. We know that when veterans go into the military, they are exposed to an array of traumas and stressors. That's either stateside or overseas. And that, coupled with injuries that are sustained during combat or during stateside, that leads to chronic pain. And so it's not very uncommon for veterans to want to treat that pain, and sometimes that leads to actually use of substances, especially if they can't get the help they need.
You mentioned that it's not uncommon. How prevalent in your research and your experience is this?
Veterans are at much greater risk to experience substance use disorders than the general population, and it's because of those stressors that they experience. But it's also about access to care. One of the things that we try to do is engage veterans early in their struggle with substance use, because we know that if we intervene early, we can get them access to effective treatments, and then that usually leads to better outcomes quicker.
Are you finding a rise in the use of substances amongst veterans?
Yes, especially in our catchment area. You know, VA Maryland, we have 3 major medical centers: Baltimore, Perry Point, and Loch Raven. And in this area, we have a great amount of alcohol use disorder as well as opiate use disorder. And so what we know is we need to provide services for those veterans because they need to get that help quickly.
How do you do that?
Well, we do that in a lot of different ways. So the first is that we make sure that we have the array of services available for folks. We offer inpatient level of care for folks that are at the highest need. We also offer residential care at our Perry Point facility. There's a program called the Substance Abuse Residential Rehabilitation Treatment Program, and it's a place where veterans can come. They actually live in the environment for usually about 45 days, and they're surrounded by treatment professionals as well as other veterans who are actually struggling with substance use disorder to get care. We also offer intensive outpatient services, which is a program that allows veterans to have about 3 to 4 days of treatment per week. And then for folks that are later in their recovery, we have supportive services. People come in once a week, sometimes once every other week, or they participate in group therapy.
By the way, what is, in your opinion, and professional folks, this term it doesn't get thrown around, but it's pretty commonplace. What, in your opinion, is substance abuse disorder? What does that constitute?
Well, for our veterans in particular, essentially they use a substance and they have to use more of the substance to get the same impact. But that, of course, leads to really negative health outcomes because it impacts their physical health. It very significantly negatively impacts their mental health. And it leads to craving more and more of the substance. So when they usually come to us, they are in a state of anxiety, stress, they want help, and they want to make sure that they're getting connected with not only the services that are going to help them, but they want to be around other veterans who are experiencing the same sorts of things so that they can learn from each other.
When you mentioned the substance and then you need more to get the same feeling, so much of that, I imagine, is not intentional.
Exactly.
There may be some sort of what I'll call quasi-recreational, but what you're really talking about is something that I imagine these veterans can't really help.
Exactly. We know that there are actually changes that occur at the cellular level in the brain that essentially increase those cravings, and they make people want more and more, and they are not in control. It's not a decision to want to use more. It is essentially a changed cellular need for that substance.
I'm glad you clarified that, because I think a lot of us on the outside might hear that term and think that this is somehow an intentional thing. Perhaps it could be on some level for a few, but the bulk of this, I imagine, as you've mentioned, is something that cannot be controlled, and thus you all are here to help. What is the difference between harm reduction and treatment of a substance use disorder?
It's an excellent question. Harm reduction, really, the whole entire approach is trying to make things as safe as possible for veterans. So we have a harm reduction program coordinator at our facility that engages with veterans. She talks to veterans about making better choices. So for instance, we have a needle exchange program where if we know that somebody is engaging in using other people's needles, which is a very dangerous practice, we want to make sure that they have a clean needle to be able to do that if they're going to continue to use. We also want them to get treatment because ultimately we want people to be able to get through their addiction, but in that course of recovery, we want to make sure that they're doing it in a safe manner. We also have an opiate agonist treatment program, a very large program down in Baltimore where we offer clinic-based methadone and Suboxone. And those medical interventions are ways for us to essentially give a prescribed medicine that takes away the need to actually use illicit substances and over-the-counter pain medications, and it replaces it essentially with the methadone and the Suboxone. And slowly over time, we know that veterans actually who are in that program do really well, and they use substances less.
You want these veterans to seek help. Are there barriers keeping them from seeking help?
Well, you mentioned before, there's a lot of stigma in the community. A lot of people believe that people make the decision to be addicted. What we try to do is break down those barriers. So we do a lot of public relations, outreach. We try to break down the barriers by having peer support specialists in our program. Those are individuals, veterans who have had lived experience with substance use disorder, and they're now in recovery, and we use those essentially as our front line out there trying to engage veterans in care so that we can break through some of those barriers. The other thing that we offer is transportation services. We have bus vouchers. We try to get veterans to our facilities so that they can benefit from treatment.
For veterans or families or spouses or anybody watching that wants to reach out, learn how you can help them or their loved ones, what should they know?
Well, first of all, enrollment in VA care is very easy. They can do it online, they can do it in person, they can do it over the phone. We want to make sure that people get enrolled in VA care so that we can then get them where they need to go for their help. The other thing we want to let people know about is that we know that substance use disorder is a often lifelong experience for folks, and that recovery process takes time. So we want to have folks understand that we're going to do all the interventions that we can do. We're going to work through with veterans who might relapse, and then we're going to always be there for them.
Dr. Jacoby, thank you again for being here. Thank you again for what you do for the folks.
Thanks so much.
It means so much to all of us. VA Maryland Healthcare System offers a wide range of health, support, and facility services for veterans at 8 locations in Central Maryland and on the Eastern Shore. The Recovery Center is an outpatient, group-based therapy program in whole health and recovery-oriented care. With the emphasis on respect, hope, accessibility, it's veteran-driven and holistic. Recovery from substance abuse disorder is possible. Learn more. Visit va.gov/Maryland-health-care.
Hear that? That's the sound of your life. Perfectly imperfect. Beating in rhythm to the world you've created. But every time you drive after drinking, the music gets drowned out. Your life sounds pretty great. Don't let a buzz ruin it. Buzzed driving is drunk driving. Don't drive buzzed.
Substance use disorder and addiction is so isolating. And so, as a Black woman in recovery, hope must be loud. It grows louder when you ask for help and you're vulnerable. It is the thread that lets you know that no matter what happens, you will be okay.
Well, about a third of adults reporting a substance abuse disorder are women. Research has shown women often use and respond to drugs differently, have unique obstacles to effective treatment, and different consequences, including the risk of losing their kids. The Helping Up mission in Baltimore has a recovery program customized for women. The Women's Spiritual Recovery Program uses faith and science to meet the specific needs of women. Here to share more is Laura Starcenik, Assistant Director of the Center for Women and Children. Laura, how are you?
Good, how are you?
All right, so tell us about your program and specifically the challenges that women face when dealing with substance abuse.
Sure, so here at Helping Out Mission, we serve women with children, and men also, historically. We really strive to provide a long-term program, have a residential side, and then also be holistic. And so we really believe that long-term recovery works. The average years of active addiction for our women currently that we serve is 17 years.
Wow.
And so we really feel that long-term recovery is really vital to really addressing some of the needs that women have when they come to our program. And the residential piece is important because inside of our building, we're able to serve their needs. Being our partners from Johns Hopkins, mental health and substance use disorder is right in our building. And then our women that are a part of our Center for Addiction and Pregnancy, which is in our building, we provide transportation to their appointments. And so one of the things that's vital to keeping people in recovery is being able to have access to all of those resources, and we do that right in our building. And additionally, as it relates to women, we have a holistic approach because we really believe there's so much more. So in our building, we have a library, we have a salon, we have activities surrounding physical health, and really most importantly, workforce development, education and workforce development, which is really critical as we're working with people over a year and really being able to link them to either a job they used to have or maybe a dream job they've always wanted. So right after their first 60 days, we start doing literacy and numeracy tests to really evaluate where people are and really start working with them. So as they get further along the program, we can really help with those needs.
Right. Let's talk science a little bit. You mentioned 17 years, the average addiction time for women. In my days in policing, I noticed it was harder for women to get off the cycle than men. Why is that?
It's a great question. So women, I think there's a lot that women carry. I think it's stigma, some. I think that when women are seeking recovery, a lot of times it's hard because they have family ties or they have children or a partner. And so it ends up being harder for women to commit to long-term recovery. We've seen that, the challenges in that. And sometimes I feel like because they're almost, in some ways, the lead of the family, it's to kind of be away from children specifically, can be challenging for people.
Right. What's the impact? How has the impact been based on your program? Success stories. What have you seen come out of that?
Yeah, the impact is really far and wide. To date, since our pilot program started in 2020, as of Friday, we'll have 71 women that have graduated from our one-year program. And 15 of them are moms with babies, which is really exciting. And so, again, the impact has been far and wide. And we really believe that, we work with women on we use a self-sufficiency matrix to really look at, we want to get people from crisis to thriving. And so we really work with women to, if we can get them to stability even throughout their time in our program, it's really important because we really believe that we're helping to stop a generational issue with addiction.
Right. So you mentioned you've been in existence, the program, only 5 years now. So it's relatively new, but this has been a problem for generations. Why is this program just coming about 5 years ago?
So, I mean, what I would say is I started in the program back when the building was being built, right? I think the need, like I said, there's not a lot of programs that really work with women with children, and that's the unique part for us. And I think that it's now being recognized that women really need these type of services, and they need it long term. And one of the things we're really seeing, and when I said earlier about the generational shift, what we're really seeing is the impact of these moms coming to us pregnant.
Right.
and the ability for us to really meet them where they are so that they can keep their children, so that CPS doesn't take their child. And we are that program where kids can come to our program even if they have a CPS case, and we work with them in order to keep them, whether they have a safety plan or they have to have visits. And so, you know, I think the need is now coming more apparent, I would say. And as we've opened the program, we've seen more of the need kind of arise. One of the things that really pushed us to do this, especially with women that are pregnant and postpartum, is that the reality is in Baltimore City, the rate of morbidity for women that are postpartum in addiction is the highest rate in Baltimore City than across the country.
Wow.
And so we really wanted to meet that need with our partners at Hopkins because it was such a huge need right here in our own city, much less across the country.
So long term, you mentioned the children. Long term, how does this affect or benefit children?
It benefits children because children are able to be with mom. Children are able to really thrive in the environment that we provide. Now, we're really here to service moms. We do have volunteer opportunities where people can come and cuddle with babies, so moms can do classes, right? Which is really critical. But really and truly, we have our maternal program manager. She does this program called Circle of Security, really helping moms understand attachment, helping moms understand, maybe for the first time, what it really means to parent. Because maybe other children haven't been in their care. And so it's really critical that we help them with their developmental needs. And so we have that, we have parenting classes, and so it's critical because babies belong with moms.
Yeah, absolutely. Last question.
Sure.
How can people help?
Yeah, there's a lot of ways people can help. So volunteering is critical. Like I mentioned earlier about our cuddlers, we have volunteers that work in our kitchen, in our library. Everything can be noted on our website, helpingupmission.org. We also have needs for babies, diapers and unscented wipes and all those things. All that can be found on our website. And also financially. All of the donations that come in through our website go directly to programming. So any way that people can help would be wonderful.
Awesome. All right, Laura, we'll leave it right there. To learn more about the Helping Up Mission and its Women's Spiritual Recovery Program, visit helpingupmission.org. Millions of Americans have mental and substance use disorders. Addiction can consume lives, families, and communities. But remember, recovery is possible. To find treatment programs in your community, visit findtreatment.gov. Thank you for joining us and making community connections.